Hello and welcome everyone. Thank you for being here today. My name is Tess Taylor and I'm a specialist in the Community Education Department at MDA. We're thrilled to have you join us for today's webinar, Home-Based Care. This learning event is part of our larger MDA community education program, which focuses on bringing the neuromuscular disease community together around education and resources. Be sure to visit the community education section on mda.org for updates on upcoming events. We are recording today's event and it will be posted on the website for on-demand viewing at a later date. If you are joining us live, please note that all phone lines have been muted, but we are looking forward to your questions today. We will have a Q&A session at the end of the webinar with today's presenter. Feel free to type your questions in using the chat feature as you think of them, and we will get to as many questions as we can after the presentation. MDA would like to thank our sponsor, Edgewise Therapeutics, for partnering with us to bring you today's webinar. For nearly 75 years, MDA has led the way in funding research to accelerate the development of new treatments, expanding access to care and clinical trials through the MDA Care Center Network, and advocating for access and inclusion for the neuromuscular disease community. Now it is my pleasure to introduce today's speaker, Lakelyn Eichenberger, PhD. Lakelyn serves as a gerontologist and caregiving advocate for Honor and Home Instead, the world's largest provider of home care. Lakelyn began her career in a local home instead, working one-on-one with aging adults. Today, she works to educate professionals, families, and communities on the unique challenges older adults face and the resources available to help them thrive. Lakelyn earned a PhD in gerontology from the University of Nebraska. She has spoken nationally and internationally on the topic of caregiving and aging and serves as a resource to major media, including Dr. Phil and Dr. Oz. Lakelyn has a passion for helping others and giving back to her community. Hi, Lakelyn, and thank you so much for being here today. We are so excited for your presentation. I will now stop sharing my screen and turn the time over to you.
Thank you so much, Tess, and thank you to MDA for having me. It's a pleasure to be here. Thank you for spending a portion of your afternoon with me to talk about home-based care. So I'm going to start sharing some slides with you, and let's see if this one works. Are you seeing it in presentation mode by chance, Tess?
Yes, we are. It looks great.
Great. Wonderful. Thank you for confirming. Okay, so as I mentioned, I'm going to be covering the topic of home-based care. And I have been in the home care industry for close to 12 years now. And I have seen home care be such a benefit to people in a variety of life stages and situations. And so I'm really glad that you're taking time to join me today to learn more about home-based care. And Tess gave a wonderful introduction. Thank you again for having me. And so why are we talking about home-based care? Well, there is no place like home. I think it was Dorothy that said it best when she clicked her heels together in her, ruby red slippers and said, "There's no place like home." That's where the majority of us want to be and stay as long as possible, no matter what health condition or challenges that we are faced with. Home is where we find comfort. And so majority of people want to stay at home. So that's why the topic of home-based care is very relevant and applicable to so many. But we do know that there's a lot of questions around home-based care, a lot of unknowns. What kind of care is out there? How do I go about getting in home care? What does that look like? And so hopefully today I'll be able to kind of answer some of those questions. And for the questions I don't get to in the presentation, we'll get to hopefully in the Q&A.
Lakelyn, so sorry to stop you there. I think you came out of presentation mode. Are you able to put your slides back? Because we're seeing the full PowerPoint.
Oh, goodness. Thank you for letting me know. Let's see here. How about now?
There you go. Thank you.
Okay, fantastic. Sorry, everyone. Technology's great when it works. All right, so we were just about to talk through what it kind of takes to stay at home. So We know that whenever somebody needs help and support, the majority of care falls first to family members. And many of you on this call today are likely one of those family members. And so family, while you're doing your best to provide for all the needs of your loved one, sometimes there are gaps in when you can provide care, or perhaps care that requires a higher level of skill. And so you start to seek out supportive services. And supportive services, they really can help fill in those gaps when the family is unable or unwilling to provide care, or when they're unavailable to provide care. Sometimes also there are those tasks that might be more of a skill that is required, and the family doesn't feel comfortable taking on that task. Or it could be something that seems somewhat simple, like, giving a bath or a shower, but there just might be an uncomfortability with having, your spouse bathe you, or an adult child helping with your bathing. So things like that can be the reason why people seek out in-home care and support. And then also, it can simply provide a break or respite for family caregivers. We know so often family members get to that point of burnout because they're constantly giving and giving of themselves around the clock. And so some time away or a break from the caregiving scenario, which we call respite, can be just a much needed way to kind of recharge your batteries so you can continue to provide the much needed care and support to your loved one. But when you are stepping away, whether it's for that break, or maybe it's to go to work during the day, or if you are, caring for, a loved one and your own children, you're kind of in that sandwich generation. Maybe you're wanting to make it to the kids' activities. You want to find a provider that you trust, to leave your loved one in their care. And so that's why it's important to start looking into these services before you need them, so you start to understand what is available in your area, what kinds of questions should you be asking, so that you can best understand the services they can and cannot provide, and how they will meet the needs of your loved one. So it's really important to think about your care team. Identify people kind of within your support network. I mentioned, family is often the first that takes on that caregiving role and responsibility. And so maybe there's some extended family members that you look to for a break or some added support. And then also other types of care providers, like home care, which we'll talk about in just a bit, or home health care. And then maybe there are other types of supports, like private duty nurses, or perhaps even community programs like a Meals on Wheels, things that maybe aren't the hands-on care, but support the individual or support the family caregiver or care partner. You can consider kind of all of those things as part of the care team. And when you're kind of evaluating your need for home-based care and services, you want to think through, okay, how long am I going to need this? Is it a few days a week? Is it ongoing? Do I have a vacation coming up that I'll just need kind of a short period of time, but, around the clock care? So evaluating, what is the need? And also, when is the care most important? Are you looking for care during the day when you go to work, for example, as I mentioned? Or are you looking for more support in the evenings, or maybe in the overnight hours, so that you can get a good night's sleep as the caregiver and know that your loved one or the person you're caring for is supported during that time period? So first, you kind of have to do that self-assessment of, okay, who is in our family's care team, who is available to provide support, and then where are those kind of gaps in care, or where is the care needed, and then think through, okay, if the care is needed, what hours or times of day are most important, and then also think through, am I flexible? Some situations you might be flexible. You're just really looking to get away for a few hours, and so if you're open to, mornings or afternoons, that flexibility is something you'll want to communicate when you're talking to the providers. And what kind of care might be needed? And this might be a review and for some of you on this call, but when you're looking for home-based care, you're going to see terms like this: instrumental activities of daily living, or the oops, I missed one letter in that on that slide. It should be IADLs. I apologize. And then the activities of daily living on the right, ADLs. So instrumental activities of daily living are things like being able to drive yourself, prepare your own meals, doing housework, shopping, managing finances, medication management, and things like the use of a telephone. So those are considered instrumental activities of daily living. And so you'll want to understand, are those types of things that you will need support with or are open to? And also you'll want to understand, is that something that the home-based care provider is open and willing to provide? And then there's the activities of daily living. And a lot of times these ADLs, which are eating, dressing, bathing, toileting, transferring, and continence, those ADLs are sometimes what are needed to trigger some benefits under some types of insurance or like a long-term care policy. And so again, you'll see sometimes those terms of ADL and IADL reference. So it's just good to know what those are and what those entail. And often, if you do kind of need verification that those ADLs are support for those ADLs is necessary to kind of qualify for the service or to get reimbursed by the insurance provider, typically the healthcare provider will be able to verify that assistance is needed with these activities of daily living, or sometimes the insurance company will send out a representative to the home to verify that those ADLs that assistance is needed for those ADLs. So I hope that that is kind of helpful in distinguishing what those two kinds of groups of activities are available through most types of home-based care. And then if there is a higher skilled level of need, then these more medical tasks could be ones that you might be looking for in terms of that home-based care provider. So rehabilitation services in the home, like occupational therapy, physical therapy, speech therapy. Maybe you need an RN, a nurse. Perhaps there's some wound care that needs attention. And also, pain management through also IVs and injections. And sometimes there is need for support with ventilators, central lines, and those types of things. So again, kind of assessing what are the needs of your loved one, so that way you can best evaluate what kind of home care or home-based care is going to be needed. And that will help narrow down your search, because sometimes in this industry, there's a lot of terminology that sounds similar, like home care, home health care, private duty nursing. Sometimes you'll hear private duty home care or companions or sitters. There's so many terms out there. And so it can get confusing really quickly. So I wanted to go through the types of home-based care that are most common that you're likely going to encounter and want to start researching. So the first is home health care. And typically home health care is for individuals that are homebound or have a medically necessary reason for the care. It's often provided by nurses, therapists, and aides. Agencies that provide home health care are generally Medicare certified. We do know that the majority, or a good portion of home health services are provided to the Medicare eligible population. And so that's why you'll often see home health care agencies promote themselves as Medicare certified. Often the visits by home health care professionals are task-based, and therefore sometimes the duration of the visit is shorter. So it might be a 30-minute to an hour-long visit. It really depends on the type of care that they are providing. And often this type of care is short-term or intermittent. So for example, if somebody is returning home from a hospital stay, they might qualify for home health care. So you can see in the boxes on the screen examples of the type of care that home health care can provide. So it's that skilled assessment, rehab, wound care, mobility, pain management. They can also support IV therapies and injections. And often the home health professionals that you will see are those licensed therapists, like the occupational therapists, physical, speech, those types of individuals, and then also nurses. And then you'll also see aides for things like bathing assistants. So sometimes they're called bath aides. And the payment for home health care, again, if you qualify for Medicare, Medicare may cover some of the home health care costs, but there are kind of a lot of stipulations around that. So for example, you likely have to be recently discharged from a hospital or rehab setting. And so again, you need to be clear, you need to clearly understand if the home health care is kind of Medicare eligible. Also, some Medicare Advantage plans are covering home health care services. Also, Medicaid might cover it. Private insurance can cover home health care along with VA benefit or TRICARE. So again, it's important to understand, how is the care being paid for? And we'll continue to talk about payment because that is always a huge question that I get asked. And I wish I had more resources for how to pay for home-based care. Unfortunately, the options are somewhat limited, and families often have to pay somewhat out of pocket or kind of puzzle piece together payment types to cover the care and support that they need in the home. So I hope that that continues to change, but that is kind of just the reality of how our system is set up here in the United States. There's also private duty nursing, and this is services provided by a registered nurse or a licensed practical nurse, LPN, in a home or residential setting. Usually the schedules are customized based on the needs of the individuals, and these types of private duty nurses can often provide a more medical level of care. You can see the examples there. There's a trach or a ventilator, there's central line. If there's any sort of feeding tubes or those types of nutrition needs, those can be provided as well. Also, payment for these private duty nurses are a little more limited in terms of payment options. So Medicaid could cover private duty nurses, private insurance might also cover it, and then private pay. So again, there's home health care, and then there's private duty nursing, and a lot of times, I won't say a lot of times, some organizations might provide both. They might provide home health care services and private duty nurse services. So again, when you're interviewing or researching these organizations, you'll want to understand the various levels of care that they can provide and make sure that it meets the needs of your loved one or the person you're caring for. Home care, sometimes you'll hear this referred to as private duty or companions or sitters. Home care services are often provided by home care aides or caregiving professionals. We call them care pros in our organization. It's a very customizable service that's really based on the individual and family's need. So it could be a few hours a day, up to 24/7, or even in some states, they allow live-in care. And really, these individuals can be an extra set of eyes and ears in the home. And some of the things that they can assist with, it really ranges from household tasks and medication reminders to preparing meals, socializing, transportation, assistance with those ADLs, so bathing assistance, restroom assistance, and also often individuals that perhaps have a cognitive impairment or a type of dementia, there's often support for that. Kind of think of it as memory care at home. And then home care can follow individuals through end of life if they are on hospice support. But home care is not a hospice care provider. And so home care, again, very flexible in terms of the type of care that it can provide. But if it does become a medical level of need, often home care will say, that's above our abilities, and we should partner with a home health company, or they might suggest a higher level of care, such as a private duty nurse. So it is important to understand, again, is home care able to meet the needs of my loved one? And if you're looking for really just respite service time away from the caregiving situation, home care could be a really nice solution. However, if the person you're supporting really does need that higher level of around-the-clock medical care, it might be best to look into a service like a home health or private duty nursing. And as I'm talking through this presentation, I think a missed opportunity on my part would have been to create an entire slide on hospice support. I apologize for that. I can always add that in and we can circulate the slides. Hospice is sometimes a really tricky service to talk about because that means we're talking about end of life. And just because somebody goes on hospice, it does not mean that they're going to pass away tomorrow. I think that's kind of a misconception, or that the end is very, very near. I think a lot of people wait too long to look into hospice services, and so that's why you see people pass away so quickly after starting hospice care. But really, those with a progressive illness that has kind of a 6 month 6 months left to live, or they are in a progressive illness that we know will eventually lead to them passing away, often they can qualify for hospice care. And hospice provides a lot of wonderful services. They have nurses that come in, bath aides, they also have social work, and then they also have wraparound services like chaplains for like the spiritual and emotional needs. They also often have volunteer programs that will come and provide the respite. So that is another type of home-based care. But hospice can also be provided in a facility as well. Sometimes that's also a misconception around hospice. Is people sometimes think hospice is a place that you go to, but it's actually a service that can come into a private residence or a home, or could go into an assisted living facility, or can be provided in kind of a hospice facility. I know my community has one called the Hospice House, and it purely is to service those who are on hospice. So that would be another type of home-based care, but again, would not really be applicable until the later stages of a person's progressive illness, or those with a terminal diagnosis. So that is a little bit about hospice. I probably won't touch on it much more, but if there are questions, of course, in the Q&A, I'm happy to share more. So most of the home-based care really is personalized, and it starts with a needs assessment. So no matter the level of home-based care that you are seeking out, whether it's that home health, the private duty nurse, or home care, likely they're going to come in and do an assessment. Often, these assessments are free of charge so that you can get to know the provider, understand what services they provide, and make sure that it's going to be the right fit for you and the person you're caring for, but also for that company providing care. Now, also, you can hire people privately, which we're going to talk more about in just a little bit. But really, after that needs assessment, then there's typically a schedule that is customized based on the needs that have been identified and evaluated. Again, the care can often range from several hours a day up to 24/7 hours a week. That's more typical in kind of the home care or the private duty nursing. Home health care, scheduling might work a little bit differently based on the need of the individual and the availability of the healthcare providers. And so you'll want to ask about that when you are meeting with them. But especially if you're looking into kind of a regular cadence of respite, a kind of regular set schedule is fairly common. And some organizations prefer that you have a set schedule, and they even have perhaps a minimum number of hours per visit or per week. Or you might choose to just schedule respite as needed. And again, you'll want to ask the provider if they do provide that type of scheduling option. So I mentioned that there are agencies and then there are independent people that you can hire privately, but there are also registries. So I wanted to go through that. When you look into the provider types, there are pros and cons to all of these types of providers. So I'm going to talk first about agencies. So agencies are companies that employ their staff. They take care of the screening, the training. Often their employees are bonded and insured. And the agency really handles all of the employment responsibilities, and then they bill you as the client. And so agencies, you might see them as a franchise system, kind of like Home Instead. That's our model as an agency. Or you might find a locally owned agency that's not part of a franchise organization. So you want to make sure that you understand, okay, who has the employer responsibility? Is it you, the agency? Or if you're working through a registry, you definitely want to clarify the employer responsibilities, because a registry, we're kind of moving to that category, recruits individuals to provide home-based care and then refers them to the customer, the client. So they might pre-screen those recruited contractors with their own criteria, but typically once they make that match, then you as the customer or the client then handle all of the employment responsibilities like scheduling, taxes, payroll. You address performance issues, those types of things. So if you think about like a care.com, you sometimes see the commercials for babysitters for children, but you might also have seen care.com that matches people for care of older adults as well. So that would be considered a registry where you go online and you get to see all the profiles of the providers, and then you choose one, they match you up, but then you kind of take on the employer role. So that's really important to understand, who is in charge of those types of things. Then the third type of provider are those independent individuals, or another way of just saying that you're hiring them privately. So these types of individuals likely market themselves and find their own customers, or maybe you hear about them through word of mouth, through another family that has used them, or perhaps you have a neighbor down the street that's a nurse who is retiring and you want to hire them privately. In those situations, you are the employer. You're screening them. All of the employment responsibilities fall to you, along with the payroll and taxes, scheduling, and performance related issues. So it kind of may seem a little overwhelming or a lot to take on, but I will say the benefits at times of using an independent or private hire is the cost. A lot of people talk about the cost of using an agency on an hourly basis versus the cost of hiring someone privately. Often the private hire might be more affordable than an agency. However, you do have to kind of look at it sometimes from an opportunity cost. You know, the agency is going to handle a lot of the things and makes it really easy. You pay them, and then they kind of take care of everything. So that's why it costs more. They have more overhead cost. If you hire privately, the cost is lower, but you're likely going to have to do more coordinating, more communication, and so forth. So that doesn't even begin to cover all the pros and cons of every single one of these types of models. But again, those are really important things to think through when you're looking for a provider for home-based care. And then there's the topic of cost. We've talked about that a little bit already. Typically, home-based care is charged by the hour. The hourly rates really vary. It's pretty broad. There is a study that Genworth, at the bottom of the slide, I have a hyperlink, but if you just Google Genworth cost of care study, they do an annual study where you can search by zip code to find the average cost of care at various levels of care in your area. So the hourly rates really do vary from location to location, and they also vary often by the level of care that is needed. So for example, in home care, if you were really just looking for an individual to come to the home to give you a break so that you can leave, maybe you ask them to prepare a meal, maybe do a little light housekeeping, that's likely going to be that first level of care. An additional kind of level of care, maybe at a higher cost, might be the case if they're helping with more of those hands-on personal cares. So there might be slightly higher costs if they're helping with bathing or toileting, or if there are kind of complex medical needs that might be at a higher level of care. So I think sometimes people ask, you know, does it cost more for the various levels of care? And that is really an important question to ask when you're meeting with the home care provider, because a lot of times it does. There's various levels of care, and the cost does increase the more kind of care is required. So you want to understand that. Also, related to kind of the level of care, there's often, as I mentioned earlier, a lot of times a minimum number of hours per visit that an organization or individual will require. And sometimes there's even a weekly minimum or monthly minimum. And so that's going to really impact the number of hours of care that is being delivered. And sometimes, again, in some states, they have live-in care where the person moves into the home and provides care. And so sometimes in those situations, there's more of a daily rate as opposed to an hourly rate. So again, you'll want to look into, what is their cost structure? Are there any discounts for perhaps overnight care if the care provider can sleep during the night, but just get up to assist when it's needed? Versus if the care provider has to be awake all night long, that might be at a slightly higher charge. So again, there's some kind of nuances to the cost of care. And then we've talked about some of the payment options already. You know, a long-term care insurance plan could cover the various levels of care. If the person is a veteran, Veterans Administration or TRICARE might help cover the cost of care. Medicare, under certain circumstances, as I mentioned, it's a little complicated. Medicare Advantage plans are starting to, some of them, you have to really look at what's included in your loved one's specific plan, but they might cover some support at home. Private health insurance may cover some of the care. And then some community organizations have grants or maybe have volunteer programs that provide volunteers to come in and provide things like respite. Pardon me, my allergies are very bad right now. Not sure if that's the case across the country, but I apologize for sipping on my hot tea because of the allergies. Okay, so I think that gives a brief overview of the cost of care at home. I'm sure you have many more questions on the cost, but it really, again, it's very situational in a lot of cases, and I wish that wasn't the case. And so you'll really need to evaluate your specific situation to see, what payment options are available. So now I want to move on to, what are some of the questions that are important to ask when I sit down and meet with a home-based provider and I'm interviewing them. And I think it is really important to interview a couple of different providers. Earlier in my career, that was my job, to sit down with families when I worked at the Home Instead franchise, and talk to them about services. And I always encourage them, please also interview another home care company in town, because you really get a feel for the organization, and you're able to kind of compare and contrast what is available, who is going to best meet my needs. And also you get a feel for kind of the culture of the agency or the individual, and that sort of thing. So specifically, these are questions for an agency. I have questions in just a bit if you're hiring someone privately, whether you go through a registry or whether you hire someone independently. So important questions to ask the agency. Of course, you want to know, are they doing the background checks, the drug screens? Are they, calling personal references? Those are kind of the industry standard, so I hope they would be doing that. You also want to understand, are they bonded and insured? It protects you as the consumer. And then you want to ensure, again, that they handle all the payroll and taxes. And if they don't, then you might actually be talking to a registry and not an agency. So again, those are important to ask. Tell us about your employees. How are they employed? Are they a W-2 employee, meaning that the agency handles all of their payroll and taxes? You also want to ask about this training and the skills of their employees. Do they provide training? What kind of training does the professional receive? Do they have ongoing training? Do the employees have license or certifications? And again, that will vary based on the type of home-based care. For example, in home care, a lot of states have some license requirements for training, while other states do not. I know at Home Instead, we have a training program for all of our care professionals that they are required to go through. But our professionals in home care, they're not always necessarily going to be a CNA, for example, but they are a trained caregiver, but might not have kind of that license or certification. Now, when you go to home health or private duty nursing, that's another story. They're likely, of course, going to have, their license as a nurse or occupational therapist or speech therapist, and those types of things. So again, you want to make sure that the training and the skill level meets the needs of the person that needs the care. That's really important. Then these are more service specific questions. I've gone over some of this already, but you want to verify, is there any minimums? Is it an hourly minimum, a weekly or monthly minimum? What all does the cost of service include? Some organizations might have different rates, whether it's for overnights or for weekend care. Often they'll have you sign a service agreement, and you'll want to understand, what are the terms of that service agreement? Can I cancel any time? Do I have to give notice to cancel? Are there any kind of deposits or initiation fees that are required to start service? Do I get that back at the end of service if I cancel care? And what is the cancellation policy? We know that the people that we care for, if they're hospitalized and we have to cancel service, what does that look like? Do we still have to pay for the care? Or if my loved one's really having a bad day and we cancel the care, do I still pay for it? So those are really important things to know. And then what restrictions, if any, apply to the services. So some organizations might have restrictions on how much they can lift, like lifting a person or helping with transferring. Some organizations, especially in the home care space, some can help with feeding tubes, some cannot. So again, you'll want to understand where is kind of this organization's boundary on when it comes to the care that they will provide. You'll want to find out, how much flexibility you have in setting the schedule. And then what if the care provider doesn't show up, or they're sick, or they go on vacation? Do you replace that caregiver with a backup caregiver? And that's very important, especially when we're relying on these home care individuals. And then you'll want to find out, how much input do I have in selecting the caregiver? Also ask, what is kind of their supervisory program for the care professionals? Does the care professional have a supervisor that they report to? Is there a quality assurance program that the organization deploys to make sure that the quality of care is where it should be? And then what is their communication plan? Because we know that the communication between the agency, the family, and the care professional is really important. So how is everyone going to stay in communication and stay on the same page? So those are important questions to ask if it's an agency. Now, if you're going to hire someone privately, you'll want to kind of look into these types of questions. And so you'll see that the word nurse pops up a lot, more because I often see kind of that nurse level of care being hired privately. So I thought we would just kind of address that directly. But also I've seen home care hired privately as well. But you want to ask, what is their history in providing care? Have they ever provided home care? Because depending on the level of complexity, providing complex medical care in a hospital can look very different than providing it in a home setting. And I know many of you know and understand that. If they have history in this, ask them why, what do you like about it? Why are you interested in home care? That can tell you a lot about a person. What is their biggest challenge that they have encountered and how do they handle that? I think that's an important one because if you do hire someone privately versus an agency, if there's an issue, they're going to come to you because you are their employer. They don't have a supervisor or boss in their agency to go to. So that can be helpful to understand how they're going to handle challenges and problems. Also ask, do they have other jobs or school obligations? Because you want to understand, could that impact their scheduling? What hours are they available to work? Which days a week? That seems like a very obvious question. And then how much flexibility do they have? Are they available for short notice if another provider that you hire cancels? For example, if you hire two private individuals to kind of, one does the days, one does the nights, do they have any flexibility to help cover if the other is unavailable? Do they have reliable transportation? You want to make sure that they're going to be able to arrive on time and that you can depend on them. You want to look into their credentials and certifications, and also ask if they have references of others that they've cared for, and actually call those references and understand, if those individuals have had any issues or so forth. And then if they have worked in home care before, maybe for an agency, you could ask for those references as well. Other important considerations for hiring privately, and I listed some questions for when you go to check their references. So, how long have you known them? What's your relationship? You can ask about their strengths, weaknesses, limitations. Would you recommend this person? Would you share anything else? So those kinds of questions, of course, important to ask a reference. But I wanted to also call out that you might want to consider an employment agreement or contract with that individual that you hire privately. And you want to consider that for a number of reasons. One, that lays out expectations for you and the person providing care. It can also help establish that employer-employee relationship. Because, for example, I know in the care of older adults, sometimes if a family is hoping to spend down for Medicaid, for example, and they've hired a private home care provider for a number of years and have been paying them privately, if there's not kind of an employment agreement or good documentation of that being a true professional relationship, Medicaid could look back and say, you've just been gifting that person the funds. So there's some kind of legal tricky things there. So that employment agreement can go a long way in setting those expectations and making sure that there is a clear established working relationship. And care.com, they have a really good article. I linked to it there, but the article is called What to Include in a Contract. So if you just Google care.com, what to include in a contract, that will pull up some really important key things that you'll want to include. And then also, I would suggest developing a tracking timesheet to document when services were provided and what types of services are provided. I mentioned earlier that ADLs, those activities of daily living, in some cases are really important to document, especially for like a long-term care insurance policy. They often ask for kind of the timesheets or log sheets of the care being provided to ensure what hours was care provided and what type of care was being provided. Did they actually care for those ADL needs that qualify them for that long-term care insurance claim? I hope I didn't confuse you there or lose you, but at the end of the day, developing some sort of tracking spreadsheet or timesheet that you print off and have them just kind of fill in, what time they arrived, what time they left, what did they do during their time there. That can go a long way, one, in helping everyone communicate, but also could be necessary for insurance claims, or if there was any sort of issue that did arise, might help to just provide some documentation. And that communication system really is so important. And that's going to look different in every unique situation, and you'll need to develop a system that works well for you and your family. So those are important questions to ask for agency, for private hire. I did just want, as I wrap up, to tell you a little bit about Home Instead. We do have 1,200 locations nationwide, and so we have been doing this for a long time. We primarily support the older adult population, but I'll tell you, in my time in our local franchise office, we did help a number of individuals that had health conditions that were at a younger age. So again, that's why it's important to ask about what services they can or can't provide. Are there any age restrictions on the care that they provide? So again, from a home care perspective, the care we provide at Home Instead, this is just a snapshot of the services: personal care, meal preparation, transportation, medication reminders, Alzheimer's and dementia care, and we can support all the way through end of life as well. So in addition to all of that I've mentioned today, on our website, homeinstead.com, we have some great free resources that can help you as you are navigating home care. So if you go to our website and you just type in the little search function, Home Care Solutions, that guide is really helpful in helping you understand the difference between home care and home health care. Also, if you're planning ahead, our action plan for successful aging can be helpful. Also, our funding solutions guide, a lot of people find that helpful. It kind of goes into a little more detail on those funding options that I have gone over in today's presentation. And then, as we talked about, everyone wants to stay home, and there are a lot of times are modifications that can be made to the home to make it a safer environment for an individual, especially if there's mobility limitations. So this home safety checklist goes room by room through the house and helps you identify potential hazards and offers up solutions on how to make the environment safer. So I wanted to include that as well. So you can find all of that on the Home Instead website. I also host a podcast called Caregiver Chats. You can find it on Apple or Spotify. One of the episodes, episode 17, I really dove into what is home care. So you could check out that episode specifically. And then I cover a whole range of caregiving topics on that. And we release new episodes twice a month. So feel free to connect with me there. And now I'll stop sharing and we'll open it up for some questions because I could see a little bit of the chat as it popped up and it was going crazy with questions. So happy to answer as many of them as we can, Tess.
Yeah, great. Thank you so much, Lakelyn. That was a great presentation. And honestly, you answered a lot of our questions
Oh,
just in
good.
that presentation. So I definitely have a few more questions for you that I
Yes.
would love to get your answers on. But yes, you were able to answer a lot of our questions already. So thanks so much. So I think we'll start with just a few of the caregiver questions. We may have a lot of folks logged in right now who are either patients or their caregivers. So how do you, as a former caregiver, avoid burnout in that field?
Wow. That is, I wish I had the perfect answer for that question because I get it asked it a lot. I think it starts with self-care. And I know that that word is overused and people roll their eyes when they hear self-care, but I think another way to think of it is survival care because you have to take care of yourself to provide good care for others. So it doesn't mean that you have to take a vacation or go to a spa, which would be lovely, of course, but it's little things you can do throughout the day for your own well-being. So even if it's just stepping aside and taking 3 deep breaths. Or I talked to a caregiver yesterday and he said he would go into the garage and do a primal scream. He said it just felt good in moments of really tough frustration in the care that he was providing his wife with. It was he this individual had frontal temporal dementia, but um, it's taking 15 minutes to go for a walk around the block, clear your head, get a little exercise and movement. It's fueling your body with things that are good for your body. Maybe trying to get one more serving of fruits and vegetables a day, or making sure you're drinking enough water. Little things like that that are going to sustain you as a caregiver or care partner, care provider. And also making sure you go to your own healthcare appointments. That is huge because so often we see caregivers put their own health on the back burner. And before you know it, they end up hospitalized or in some really sad scenarios, passing away before the person they're caring for. And we don't want that. So if you're attending to your healthcare needs as well, that will also help identify any issues that come up and help you make sure that you're taking good care of yourself. So find healthy outlets for your stress and emotions. Maybe it's journaling. Maybe you're a person of faith and it's going to a faith service or prayer or meditation. But finding that healthy outlet, moving your body and fueling your body. Those little acts of self-care, survival care, whatever you want to call it, will go a long way in preventing that burnout.
That's wonderful advice. Thank you. So pivoting to another question, do you know of any programs that for perhaps a caregiver who's there for a spouse or a child, do you know any ways for these to become paid positions? So of any state resources? I know you mentioned registries, but do you have any resources around that idea?
Yeah, that is a great question. And I recently, somebody from a website called Givers, Givers is the website name, and their website is joingivers.com, joingivers.com, joingivers.com. They have a spot on, they help caregivers understand can they get paid as a caregiver. And it actually is a state by state guide for potentially being compensated as a caregiver. So I would definitely check that website out because it will vary state by state. From what I understand, is that various states have different programs. So you might be able to be paid in one state, but maybe not in another, or it might be circumstantial as well. So certainly look into that because if you are providing that around the clock care, you can get paid for it. That is wonderful, but still make sure you're doing those self-care activities, or making sure you get a break and get a little bit of respite or time away so that you can take care of your own health and your own well-being.
Great, thank you. So on that note, we actually had a lot of questions about state-specific resources, depending on where an individual lives. Do you have any other information? I know you mentioned the Genworth Cost of Care survey and some other opportunities, but do you have any information on where people should go if they need state-by-state information?
That's a great question. Yes, the Genworth Cost of Care, that's really going to give you just estimates on what care costs. There are a couple sites or places you could go to find more information. Benefitscheckup.org is a place where you can go and type in your zip code, and it helps you identify any benefits that you could potentially qualify in that area. So that's a great place. Again, that's benefitscheckup.org. Also, for those that are 65 and older, your area agency on aging can be a really great resource. Also, often states have, I know here in my state, it's you can dial 211. It's kind of an information system that's put out by the state's healthcare system. So the Department of kind of Health and Human Services. So you can contact them as well to see what might be available in your area. So those would be places I would suggest you start first. But a lot of things, unfortunately, are very state specific and even county specific, or kind of region specific. So it does take some research. And so again, I'm grateful everyone's joining in today to learn more, and hopefully this helps point you all in the right direction.
Absolutely. And I appreciate you sharing those resources from the Home Instead website as well, because I think those could be great resources for everybody.
Absolutely. Yeah.
Great. So we do have a couple specific questions from the chat that I would like to get to as well. One that I thought was really interesting that we didn't quite cover was, how early should someone be looking into home care? Is this something they should plan on in advance, especially if they have a progressive diagnosis, or should they wait until the situation occurs?
Such a great question. And I would say the sooner the better, because in some situations, depending on the payer source, there could be wait lists. For example, Medicaid, often there are wait lists for waiver programs and other programs that support in-home care. So start looking into services before you actually need them. That's going to be beneficial for the reason I just mentioned, but also it's going to give you time to research, to find providers that fit your situation. And then that way, if you do enter a crisis, or care does become such that you need support, you're not scrambling. You've already done some research, you know what's available. You probably also established a relationship with a provider, and then that way you can kind of deploy what you have researched, and then set the care up. So I would say the sooner the better, because again, you don't want to need the care and then be told, sorry, there's a wait list.
Yes, absolutely. Thank you. So another question from the chat. How can I stay in my home when state Medicaid refuses to cover overnight hours for things such as repositioning or going to the bathroom, and family is not around to help during that time?
Wow, that's a really, really tough situation. And you could potentially look into other kind of community resources or kind of grant related services to see if there is anything available in your area. That overnight care, I can understand how that would be so vital, in being able to stay at home longer. And that I know is most people's goal. So, continue to look into resources that might be provided in your area, and see, could maybe the services be provided at night instead of the daytime if that's when the support is especially needed. So see maybe if there's any flexibility, and see if there are any other resources out there. But no, you're not alone in that struggle. I've heard other families encounter similar challenges.
Yeah, absolutely. Sometimes there's not a clear-cut answer with these things, so we just do our best with the resources we have. And again, I would like to point everyone to MDA's resources that Jessica's been sharing in the chat, and also Lakelyn's Home Instead resources will be a great benefit to everybody. So let's just take a few more questions. And to everybody who's still here, I hope that if your question's not answered today, we will point you towards our MDA Resource Center, where we have staff available to help answer your questions and find people who can support you 24/7. So I'll give resources for that later, but let's just go ahead and wrap up now with a couple questions about a little more on the adolescent side. I know in MDA community education, college planning is a really big thing right now. So do you know if the home-based supports can apply to students who are looking to move away to college or wanting to live in a dorm life? Can they hire people to be with them on site at their college?
That is a really good question. And I want to be very transparent. That's not an area of expertise in the home-based care that I personally have. But if you are working with an organization that is kind of a franchise or has a regional or national network, what might be helpful is to see if they have a location wherever that individual is choosing to go to college, because that might help you make a more smooth transition to working with somebody more locally. So I think that those are really important questions to ask. And also, I would see if the college has any resources. Perhaps there's like a peer-to-peer student program that the college has set up for individuals that need extra support, or perhaps there's kind of a roommate program that does special matching based on kind of the needs of their roommates. So that's inspiring me to go look into that because I'm curious to learn more.
Well, for that not being your expertise off the top of your head, those were some great suggestions. So I'm sure that's beneficial. So our last question for today, do children under 18, do you know, adolescents, do they qualify for these services with or without Social Security benefits? I know you touched on this a little bit, but just exploring that a little bit further for our families.
Yeah, that's a really good question. I think that is a question you will need to ask. From my experience, typically there are separate organizations for home-based care and support for children versus home-based care and support for those kind of 18 and older often, or whatever the legal age in the state is for adulthood, whether it's 18 or 19. Typically there's kind of a split, or an organization might have services across the demographics, but I more typically see services kind of split out for those kind of two age groups. I would say again, the younger demographics is not necessarily my area of expertise. It's something I'm learning more and more about, and so often I believe those types of services that serve a younger demographic would have similar payer payment options for things like private insurance or Medicaid, but that would be something it's a good question to ask when you're looking into that type of care.
Great. Well, thank you so much for all of your wonderful answers and for your presentation today. We really did enjoy having you, Lakelyn, and thank you so much.
Thank you so much for having me. It was a pleasure. Take care, everyone.
Thank you. So just so everyone knows, we did have an overwhelming amount of questions on home-based care today through our registration and live in the chat. And although we are concluding today, we encourage you to reach out to our resource center, and I will provide information for that in just a few slides. So please stick around. If you are new to MDA and have been diagnosed with a neuromuscular disease under MDA's umbrella, or if you are a loved one of someone who is diagnosed, we encourage you to stay engaged with us here at MDA. You can do this by visiting mda.org/join and completing a short form. Joining is free and will keep you up to date on the latest research, educational programs, and supports. MDA has ongoing webinars, virtual learning programs, and live events that may be of interest to you. Be sure to check our webpage frequently by scanning the QR tab at the right of your screen, or visit us at mda.org/care/community-ed. MDA would again like to thank our sponsor, Edgewise Therapeutics, for partnering with us to bring you today's webinar. We would love to hear your comments about our webinar today. Once you leave, a web page will automatically pop up with a short survey. Completing the survey provides us with important insight as we plan for future educational programs, and your feedback is truly important to us. If anyone has questions after this webinar that we weren't able to answer today, please, I encourage you to contact MDA's Resource Center at 1-833-ASK-MDA1 or email the Resource Center, that is resourcecenter@mdausa.org. You can get connected with a real live person and they'll be able to connect you with questions about home-based care, insurance, and anything that we are able to support you with. We do hope that today's webinar was really beneficial, but if you do have those follow-up questions or need those resources, we are here for you. Thank you again to Lakelyn Eichenberger for her wonderful presentation, and thank you to everyone who attended today. This concludes our webinar. I hope everyone has a great evening, and we hope to see you again soon. Goodbye.